Hi, and welcome to Abundant Health Physical Medicine. My name is Dr. Sanan Gutchman, and on behalf of my team and myself, I want to welcome you into the clinic. Now, I know that you're here because you're more than likely dealing with neuropathy, and you're not alone. Over 20 million Americans are suffering with neuropathy and its different variations, whether it be diabetic, drug-induced, chemo-induced, just to name a few. The common treatments out there aren't cutting it. A lot of the times when people have come in to see me, they are told by their medical professional that they're just gonna have to live with it. Well, I can tell you after years of doing this that that's not the case. That doesn't have to be your prognosis. We offer many different restorative treatments here in the clinic that are natural and holistic. Doesn't involve another drug. We know that that's the last thing most people need. They need something that's gonna actually get to the root cause of correcting the problem. Imagine what it's gonna be like to get 60% improvement, 70% improvement, 80% improvement. These are things that we see regularly happening in our office. And these are results that last. What makes our care so effective is that right away we focus on goals. We want to understand what is it that you want to achieve? What is that you desire in working with us? Clinically, I want to make sure that your neuropathy doesn't progress, at the very least, right? Making sure that does not get worse. Second thing is that we want to avoid the very severe consequences that can be a result of advanced stage neuropathy, whether it be from being confined to a wheelchair or a walker, losing your independence and not being able to drive a car, and even in the most severe cases, it can even lead to amputation. I want you to take a moment and just reflect and consider what your goals are. And if you've got a piece of paper handy, even just jot those down. I hope you've had some time to write down 1, 2, maybe even 3 goals. Remember, these are the things that you really want to achieve because you worked so hard to get to and to be able to do. What I always like to do first before we get into exams and even screening is just really making sure that you have a clear understanding of what neuropathy truly is. What is peripheral neuropathy? We know that peripheral neuropathy is a progressive circulatory disease. It affects primarily the hands and the feet, and it affects the outermost parts of it. Also, key point here is that it affects both sides. It's bilateral. It's not just one hand, it's both hands at the same time or both feet. And it affects the outermost parts. We're talking like the tips of the toes, the tips of the fingers, and it can begin to work its way up. In the feet, for example, it will work its way up the leg, but it will not cross the knee. And in the hands, upper extremity, it will not cross up into the forearm or the elbow. Let's talk about some of the common symptoms that people deal with that maybe you yourself are also dealing with. These can be things like numbness and tingling in your hands or your feet, a sharp stabbing pain, extreme sensitivity to light touch, maybe the sheets going over your toes at night when you're laying in bed. I've had patients tell me that it feels like their toes are about to explode. Another one is balance issue. It's amazing how so many different people will use the same descriptors. Things like it feels like there's socks balled up in their shoes or walking on bubble wrap. They just, again, can't feel the ground underneath their feet. They're unsteady, staggering. Maybe you've heard of people who accidentally drive through a friend's living room or they drive through a storefront, and that's because the inability to feel the gas pedals underneath their feet. Those are some of the common symptoms that I hear very frequently when it comes to neuropathy. And if you're experiencing one or more of those symptoms, then we know your condition is progressing at an advanced rate, and we need to put a stop to that as quickly as possible. Now let's talk about what a healthy versus a diseased nerve looks like. Nerves are living tissue, living fibers in our bodies. These nerves are responsible for sending information from the brain, down the spinal cord, and out to every single cell, tissue, muscle, and organ in your body so they can do what they're meant to do. Now, a healthy nerve, for it to stay healthy, needs nourishment. Our nerves are wrapped up in blood vessels. These blood vessels deliver red blood cells and blood to the tissues to give it a very specific nutrient, a very specific molecule, which I'm going to get to. In neuropathies, what happens is those blood vessels get attacked. They begin to get diseased and damaged. When those blood vessels are getting diseased and damaged, they're not able to give that nutrition to the nerve itself. And over time, if that's not corrected, that's where the progression of this disease happens. The nerve literally shrivels and becomes damaged when those blood vessels disappear. So now let's talk about what's being done in the traditional sense to address neuropathy. Traditional neuropathy treatments involve typically some form of medication prescribed by either your MD, your neurologist, or even a podiatrist. The ones I see come across my intake forms that people fill out is typically gabapentin. That seems to be the most common, followed by Lyrica, Cymbalta, or Neurontin. These medications are not even neuropathy medications. There's no such thing. These medications are actually anti-seizure medications or anti-epileptic medications. The best thing that they can give you is something that is for somebody who has seizures, and that's probably not you. And all these medications, the only thing they're really doing is just interrupting the signal that's coming from the foot or your hand to your brain that's triggering that numbness, that pain. And again, it's just at best trying to block that sensation, that symptom. But ask yourself, and you probably already know the answer to this, is it really fixing the problem? And you can probably bet it's not. What we find is that when people are on these for any period of time, it actually is causing a further decrease in that capillary volume, those blood vessels wrapping your nerves, ability to give blood, send blood to your nerves, allowing for this condition to progress even further. So we have to find a way that, again, is getting to the root cause of correcting this problem and not just treating the symptoms. It never works to treat the effects. We have to get after the cause. I mentioned earlier that neuropathy is a progressive circulatory disease. Why is it that circulation is so important? We have to look at what is it that is being sent through your blood vessels to tissues. In your blood vessels, you have blood plasma and you have red blood cells. The red blood cells are floating in the blood plasma. On those red blood cells are a very specific molecule, and this is the molecule that's responsible for keeping you and I alive. And I want you to think a moment and ask you a question, see if you can figure this out. What is the one thing you need to live, which is cut off right away, you wouldn't last but a few minutes? And that's oxygen. Oxygen is the fuel source for our cells to do their job. I want to paint a picture for you so you can kind of understand how a cell works. Think of the cell as a car. A car is made up of many parts, and there's one thing in the car that makes it go. The thing that produces power in the car. What is that? It's the engine. So you have the engine in the car, that's what makes it go. But you can have a brand new car with all the new parts and a brand new engine in it, but if it's missing one thing, it's not going to produce the power it needs. What does an engine need to produce power? Well, it's fuel. Okay, what is that fuel in a car? Well, it's gas. Apply this to a cell. You have the cell. The cell has many parts. The engine of the cell, or the powerhouse of the cell, is the mitochondria. This is the thing in the cell that makes power. And a crucial component that the mitochondria needs to produce that power is oxygen. Okay, oxygen is that fuel source for your mitochondria to produce power in the cell, also known as ATP. We get your mitochondria producing more power, that means that cell is going to work better. And here we're talking about the nerve cell. Clinical evidence-based research shows that hyperbaric oxygen therapy is one of the most effective ways to perfuse the body with oxygen. I'm going to play a brief video for you that explains what hyperbaric oxygen therapy is.
To fully understand the benefits of hyperbaric oxygen, we must first understand normal circulation. Our heart pumps blood to our lungs where carbon dioxide is exhaled and oxygen is inhaled. Oxygen enters our body through our lungs, attaching itself to our red blood cells. Blood returns to the heart and is then pumped throughout the body. Typically, as this system is working properly, we are all already near 100% saturated with oxygen. As blood circulates, oxygen leaves the red blood cells and enters your body's tissue and cells, providing necessary fuel for normal function, energy production, and healing. And the cycle continues. So, what is the difference between oxygen absorption when breathing air versus oxygen absorption when breathing in a hyperbaric chamber? Under hyperbaric pressure, in addition to the normal absorption, oxygen will also dissolve directly into tissue and blood plasma, increasing our absorption by 28 to 40%. This extra oxygen promotes further healing, quickens recovery, restores mitochondrial function, reduces inflammation, kills anaerobic infections, fuels cells, and heals the nervous system. This helps people with a variety of autoimmune and degenerative diseases, inflammatory conditions, certain infections like Lyme disease and co-infections, autism, post-surgical healing, stem cells function, dementia, and many more.
So now let's talk about what abnormal blood flow looks like with neuropathy. Nerve fibers are wrapped up and enveloped in blood vessels, specifically blood capillaries. Those capillaries become so damaged and so thin that those large red blood cells are unable to flow through the capillaries to be able to perfuse and give that oxygen to the nearby surrounding nerves. So what happens? The nerve is deficient of the oxygen it needs, and as a result, it's taking a bath in acidic CO2 that's building up, that the red blood cell, if the oxygen was flowing through naturally, would pick up that waste product on the way out, going back to why proper circulation is so important. Utilizing hyperbarics, what we're able to do is when you go into the chamber, your body is being subject to that increase in atmospheric pressure, just 30%, and that 30% increase will increase your body's oxygen perfusion by anywhere from 28 to 40%. So these spaces that are now too narrow to get normal red blood cell flow through into it are being saturated, filled with oxygen. I'll use another analogy here. What happens when you open a bottle of soda? Gas escapes, right? So when we are in a hyperbaric oxygen therapy chamber, our bodies are being perfused and filled with oxygen. And when we come out of that pressurized environment, very similar to opening a bottle of soda, the gas, the oxygen escapes out of your tissues, your blood plasma, and it goes to all the nearby surrounding tissues and cells, giving it the oxygen it needs to function optimally and properly. So now, we understand that hyperbaric oxygen therapy, or HBOT, is a very, very effective way to increase oxygen levels in our body to encourage that normal healing functioning response. So now, anything else we then do when combined with hyperbarics is going to work that much better. The results, the effectiveness of it are just naturally increased. One of our other signature therapies is whole body red light therapy. How many times have you been told to go outside and play in the sun or get some sunlight? It's good for you. The sunlight has physical property to it. There's a specific wavelength of light that lives in about the 600 nanometer to 800 nanometer wavelength spectrum. And that wavelength, unlike UVA and UVB light, which is what can give you a tan or even burn your skin or cause skin cancer, unlike those wavelengths of light, red light actually penetrates deep into our tissues, going through muscle tissue, even into bone tissue. Red light therapy, again, clinically evidence-based to have many, many therapeutic benefits, from reducing inflammation, whether it be to chronic inflammation like fibromyalgia or arthritis, improves vasodilation, the opening of blood vessels, which will improve blood flow and circulation, and to help even kickstart cellular repair and regeneration, because again, like hyperbarics, it's giving fuel to the mitochondria in our cells. And because hyperbarics raised your level of oxygen in your body, this allows the red light to work even better. With our next therapy, we're going to get specific, we're going to get local, we're going to target the actual area where you're experiencing these symptoms. Soft wave is a very powerful regenerative therapy. What makes it so powerful is that it will identify or diagnose where the damaged tissue is. So there's no guessing when it comes to your treatment. We'll know specifically where to apply the treatments themselves. Your feet, for example, we'll know exactly where on the foot to make that treatment. The power in the treatment is that it's diagnostic. We're not just guessing and just blanket treating an entire area. Soft wave achieves or accomplishes 4 primary goals. Number 1, it increases the blood supply. You've heard this many times already. It does this through an angiogenic effect, just like hyperbarics and red light does. Angiogenesis means the creation of new blood vessels. Second thing it does, modulates inflammation. Inflammation, we know, is a big driver of pain. Third thing, it will break up chronic scar tissue derived from old injuries. And the fourth and most important thing that it does, it will activate and cause a migration of your own resident stem cells to begin to move to the area that we're treating to accelerate that regenerative healing process. Soft wave therapy, again, is a very specific treatment that we use to get local with your treatment and address the area specifically that is of your concern when it comes to your neuropathy. The next thing that we have here in the office really helps improve balance, coordination, and posture, as well as creating more vasodilation and circulation in the body. And that's whole body vibration therapy. With our whole body vibration therapy, you simply stand on one of our platforms, and then the device itself will begin to vibrate. And that vibration causes proper lymphatic drainage, improves blood flow and circulation, and also the added benefit of helping you improve your posture. And now for our most advanced cases, those who have been suffering with neuropathy for a very long time, and for those that have a very high degree of sensory loss, we do also have regenerative therapies in our office available in the form of stem cell therapy. Whether that be injection or infusion, stem cell therapy is the most advanced form of regenerative therapy, and I'm proud to say that we offer that right here in our clinic. So now that concludes what we do here in our office. And what makes our program so effective is that we have ways to take what we do here in the clinic and get even more out of it at home. A part of that is our 90-day nerve spa protocol, which includes multiple different modalities, from aquatic TENS, which is an aquatic neurostimulatory device. You have your own version of red light therapy and cold laser therapy, to specific nutraceuticals that are designed to improve blood flow and circulation with nitric oxide, different amino acids and supplements, which helps to protect and repair nerve endings, to your own vibration plate as well. Now, one thing we can't forget is that the way your body metabolizes energy and gets rid of waste products and digests food and absorbs nutrients is crucial. If you've been on any kind of antibiotic before, or have just not had the cleanest of diets whatsoever, our gut microbiome, our gut environment is a wreck and needs to be reset. A big component of this is being able to reduce inflammation in the body, and through our gut health, we achieve that. We've been doing this a long time, and we've been blessed to be a part of many people's transformative testimonials and experiences. So I'm just gonna play a couple quick videos for you. First, you're going to hear from Joe and Kayla and what their experience was like in going through our neuropathy protocol.
I've been dealing with foot pain for probably a good 15 to 18 years, and my foot pain got worse. But Kayla found this Dr. Sinan and great clinic here. I can walk a lot farther, I'm walking faster, I'm walking a whole lot easier.
So I made the contact, we came over for the evaluation, and we're glad we did.
I would recommend it highly. I like my feet now.
He loves his feet again. How great is that? Next, you're gonna hear from Terry and her experience.
I just felt like I wasn't totally touching the ground. Tingling and some leg issues as far as cramping. Since the beginning of my treatments, I have gained back 75–80% of the feeling in my feet. I'm able to keep up with my grandkids. I'm still able to garden, and I highly recommend Dr. Sinan and Abundant Health for those who are interested in keeping their health and vitality going.
So we've covered a lot. What is our purpose? Me personally, again, I want to make sure that we stop the progression of your neuropathy from getting worse so that we can avoid those very serious consequences. And then hopefully you write down a couple of your own goals. So take a moment, just look at those. Now, remember, think back, how long have you been dealing with this for? How long have you had it? And when you get it, how often do you experience it? And when it's at its worst, how bad is it? And what are some of the things that you've tried so far that just ultimately haven't panned out, haven't worked out? And now think about this one. What would happen if you did nothing about it? Blinked and you closed your eyes and 5 years went by. What would things look like? So considering all those things, hearing everything you've heard and everything we talked about, what are your options? I want to say thank you for taking the time to get educated on what neuropathy is and ways to treat it to get relief so you can live the life that you deserve.